Hi, and welcome to our group project for Social Work 503, Ms. Jenkins and the Nursing Home. Our group consists of Keisha Merrow, Asia Jackson, Jasmine Brown, Simone Ray, and Jen Cole. Here's our introduction. Hi, welcome to our group project for Social Work 503. We've chosen to do a conflict scenario which occurs in a nursing facility regarding Ms. Jenkins. I'm Jen, I'll be the narrator. Asia and Simone will play Ms. Jenkins' daughters. Jasmine is one of the nursing home direct care staff, and Keisha is the nursing home social worker. Ms. Jenkins is 85 years old and had been living with her daughter Asia since the passing of her husband, Mr. Jenkins, a few months ago. Ms. Jenkins' other daughter, Simone, was over the home frequently to assist with her care as well. The family is very close. Both daughters work full-time and have been struggling to meet their mother's growing needs. They have noticed that she can't remember simple things like her children's name and will be forgetful, misplacing items only minutes after she set them down. Both daughters feel that since their father had passed away, that Ms. Jenkins' symptoms had worsened. Ms. Jenkins was reluctant to go to the doctor, but finally agreed at her daughter's urging, and she was diagnosed with dementia. Due to that diagnosis and her growing needs, Simone and Asia made the difficult decision to have their mother move to a nursing facility. Ms. Jenkins was not pleased with this decision, but after much discussion with the family, she agreed that it was the best way to ensure her safety and health. Asia and Simone spent a good deal of time researching to find a nursing facility that would provide suitable care for their mother that was nearby and affordable. During her admission, they spent time meeting with the director of the facility to discuss their mother's needs. They acknowledged that this was a very difficult decision for them, and they knew it was a hard transition on their mom as well. The director gave them a lot of comfort and hope that she would be well cared for. Over the next few weeks, Simone and Asia visit their mother and find that her mood has worsened and she appears to be very depressed. For our scenario, Simone and Asia have come to visit their mother today and are upset to find that not only is her hygiene poor, but she also has possible injuries, including bruising and sores. As they discuss this issue among themselves and become more frustrated, Jasmine walks by and they confront her about their concerns, questioning her about the quality being provided to their mother. Jasmine becomes defensive and the conflict escalates. The group finally requests Keisha's assistance to help them solve the problem. Keisha will try to apply methods of conflict resolution to bridge the gap between the women. Let's watch.
Simone, did you see the marks on Mom's body?
Yes, I'm tired of this mess and this unprofessional facility.
We don't pay them all this money for our mother to continuously have marks on her body.
I agree. We need to speak to one of the staff members right away.
Are you the one caring for our mother? Me and my sister would like to ask you a couple questions.
Look, I have other patients I need to check on. Y'all are going to have to wait. And who is your mother?
No, we won't wait. We need to speak to you right now about Miss Jenkins.
Fine, what do you want?
We can't understand why our mother continuously has unidentified bruises on her every day. We see bed sores, unidentified marks, and smell urine in her room.
It's your job to provide my mother with the care and compassion daily, right?
Compassion isn't in the job description, honey. Besides, your mother is aggressive and her skin is thin. She likes to bite us. She refuses to get up, and we can't make her participate, and our staff is low right now. I might as well be the only person working here, and I have other residents besides your mother.
I understand that my mother can be very difficult at times, but the staff here should be trained to handle more difficult patients. I'm just sick of this place and all the staff altogether.
You and me both.
Well, we need to speak to the director ASAP.
The director isn't here at the moment. All I can offer you right now is a resident social worker. Would you like to speak with her? Here she comes now.
Good morning. Hi, Ms. Jenkins. How are you? Hi, my name is Keisha. I'm the unit social worker. How's everyone doing?
Not good.
Simone and Asia have had a difficult few months. They lost their father and discovered that their mother has dementia. They struggled with the decision to place their mother into the nursing facility after they admitted they could no longer meet her needs at home. During the admission, the nursing home director had assured them that their mother would be well cared for at the facility. All of this occurred before today's visit and has set the tone for their reaction. When the sisters visit their mother, they become concerned about her well-being and the care that she is receiving at the nursing home. Miss Jenkins is depressed, she has bruises and bed sores, and her room has an odor. Asia and Simone confront the staff person Jasmine as she walks by on her way to another patient. Jasmine feels attacked and becomes defensive. She is not familiar with who Asia and Simone are, and she was not anticipating this exchange. The sisters request to speak with the director, who they had initially put their trust in, but the director is not available for them to talk to. Keisha walks into the situation while checking up on Ms. Jenkins. Wow, they seem pretty upset. Keisha, the social worker, will now provide each person with an opportunity to allow them to feel seen, heard, and known by talking about their own relationship with Ms. Jenkins in an effort to build better group relationships. Here she goes.
I apologize. Can we start over? Agent Simone, we've met before. Could you tell Jasmine about your relationship with your mom?
Our mother is an 85-year-old lady who has been through a lot of difficult times in her life.
We understand that she can be difficult and hard to manage at times. We know that she just wants some companionship because her father passed away within the past year. She's still grieving and has to be handled accordingly.
Asia was caring for our mother prior to her being in this nursing home. I would stop by often throughout the day to assist her with our mom.
You have to understand our concerns when it comes to our mother. We owe her enough to at least make sure that she's being properly cared for. She made sure me and my sister was properly cared for since we were born.
Every time we come to visit our mother, something new appears on her body. So yes, we do feel like she's being mistreated and the staff doesn't care about her. They aren't extending her the proper care that she deserves.
We researched this facility before we placed our mother here. What stood out the most was the quality of care that this nursing home was providing. We aren't getting that quality of care right now.
Agent Simone, thank you for sharing that. Jasmine, could you tell them about yourself and your nursing home experience?
Well, I've been working in nursing homes for many years. I love working with the elderly. They are a joy to work with. I love helping them through the difficult times and making them feel loved away from home. Ms. Jenkins is special. She has her good days and bad days. It's hard to get her up sometimes because she is in a nursing home. I understand how you are feeling and you're distressed about how we do things here. It may take some time, but we can work it out. I have gone through a similar situation with my own mother who recently passed away, so I understand where you are coming from.
We apologize for being so hard on you. I can imagine how hard and stressful it might be to work in a place like this.
Like we mentioned before, we just want the best care for our mother. It may take you some getting used to because we're used to caring for our mother.
We got used to how we care for our mother, and now we have to adjust to the way the nursing home is caring for her.
Please understand our concerns and know that we are working on becoming familiar.
We do appreciate the care that you are providing. We thank you and other staff members.
I will be sure to make a better effort in seeing that your mother is being cared for properly. I can also provide you with my schedule if you all want to reach out to me directly.
Jasmine, thank you for sharing, and thank you for letting each other be seen, heard, and known. If there are any other issues, feel free to reach out to me.
Keisha provides Asia and Simone an opportunity to describe their relationship, experience, and current concerns about their mother. The sisters are able to share with Jasmine that their father recently passed, that they have been caring for their mother, and that they are worried about her. Jasmine is able to recognize the contribution they have to their mother's care and relates it to the recent loss of her own mother. By understanding where the sisters are coming from, Jasmine is able to address them calmly and with empathy. Jasmine is able to discuss her nursing home experience and her challenges at work. By knowing Jasmine's situation, the sisters are able to build trust with her and become aware of the conditions at the nursing home. The sisters feel seen, heard, and known by Jasmine and Keisha. They are able to realize Jasmine's constraints, but be aware that her goal ultimately is to care for their mother and that she is doing her best. The group has not reached resolution, but they are better equipped to move forward together. According to Beth Burrell, we all want to be seen, heard, and known. These are core needs. By offering Simone, Asia, and Jasmine each an opportunity to describe their connection to Ms. Jenkins, Keisha gave them a chance to be seen, heard, and known. When group members are not given the opportunity to be seen, heard, and known, according to Beth Burrell, they will become preoccupied with finding means to establish and protect their identity within the group. Keisha's intervention allowed for the group members to focus on the issue at hand, rather than jostle for control or position in the situation. Keisha has created an environment of empathy. She is ensuring that both the sisters and Jasmine are able to immerse oneself in another's experience and to imagine the feelings of the person in that situation. From Murphy and Dillon. Now Keisha will use common ground in order to address the conflicts. Common ground is a strategy that requires each participant to speak their piece while another participant paraphrases their words until the initial speaker agrees with what was repeated. Let's watch.
At this time, I want to give you and your sister an opportunity to speak about your concerns and issues regarding your mom. Ms. Jasmine, while they're talking, you will just listen. When they're done, you will need to paraphrase what they said so that they know that you understand their viewpoint. Simone, Asia, let Ms. Jasmine know how you feel about the situation.
Our mother means everything to my sister and I. We want nothing but the best for her while she is in this facility. We expect that she will be cared for and treated with care and compassion at all times.
When we come here, our heart breaks because we can see that our mother isn't happy. She wants to feel welcomed and loved. We believe the staff here should be able to provide our mother with those type of things, if not more.
She is going through a hard time right now with the recent death of our father. She just needs some extra care right now. We are entrusting you with her well-being. We expect her to look the same way that she was brought in here.
If issues should arise and she is being difficult, we don't want the staff to hesitate to give us a call. We want to work together so that this experience for our mother is a good one.
Jasmine, tell me what you heard Asia and Simone say.
I understand that you all care a lot about your mother and want her to receive the best treatment and compassion as possible. Ms. Jenkins may be experiencing some unhappiness because of her recent move here and the recent death of your father. You also want to be notified if your mother is being difficult or if we need help working with her.
Asia and Simone, did Jasmine properly say what you meant?
No, she forgot to mention that we expect for our mother to look the same way she did when she arrived to the facility, because she didn't arrive to the facility with any bed sores or bruises.
Jasmine, could you paraphrase that back?
So you also expect Ms. Jenkins to not have any bruises or bed sores?
Asia and Simone, now, has Jasmine properly said what you meant?
Yes, that's correct.
Now, Jasmine, tell us your issues and concerns with providing care to Ms. Jenkins.
Well, it is very stressful working here. It is hard to give your mother the attention she wants because we are so understaffed. I'm doing the best I can with trying to offer compassion to your mother, but it is hard when I'm being pulled in so many different directions and with her unwillingness to participate. The biggest issue with her is getting her to stay active. I'm not sure if she likes it here, but I have to give the same amount of attention to everyone, and your mother is no exception.
Asia and Simone, tell me what you heard Jasmine say.
So you're saying that this is a stressful environment and the nursing home is understaffed?
and you're trying to do the best you can with all the residents at the nursing home, but it's hard, especially when people are unwilling to participate. You also try to show compassion for all of the residents.
Jasmine, do you think Asia and Simone were able to understand what you're trying to say?
Yes, that is accurate, but I also want to include that we would never intentionally hurt or ignore your mother or anyone in the facility. We are trying our best to encourage and engage with your mother.
Asia, Simone, can you paraphrase that?
Okay, so you're saying that your staff won't hurt those who enter your facility and participate in different activities at this facility.
Okay, so Jasmine, is what Simone said paraphrased correctly?
Yes, that sounds correct.
Simone, Asia, and Jasmine appear to have reached common ground. Let's look a little deeper into Keisha's efforts by examining the conflict and resolution techniques. In order to find common ground, Keisha offers Asia and Simone an opportunity to explain their concerns to Jasmine. Keisha has Jasmine listen and paraphrase back what the sisters are saying. The sisters note that Jasmine has missed part of their statement, and Keisha asks Jasmine to repeat that part back. Keisha then has the sisters confirm that Jasmine has captured their concerns. Keisha offers Jasmine the same opportunity to speak about her experience. The sisters then rephrase Jasmine's input and reiterate what she felt they left out. While the conflict is not yet solved, each party is aware of the other's concerns and feels heard. Resolution can now begin as they have discovered their shared purpose, which is to care for Ms. Jenkins. Common ground strategy involves the facilitator having a participant explain their viewpoint, followed by another participant paraphrasing it back to them. The facilitator ensures they do not speak over each other or interrupt, and confirms that the initial speaker feels that the paraphrase has captured their meaning. The facilitator will continue to request additional paraphrase until the first speaker indicates that they have been fully heard. Dr. Barol explains the Common Ground exercise offers a pathway for the group to successfully resolve the conflicted stage of the group process, empty itself of self-righteousness and of the us against them stance, and move into the community stage. Common Ground can provide validation to the speaker. According to Murphy and Dillon, validation is when we appreciate the realities of the client's story. Now we would like to share our group discussion with you. We will talk about how we came up with the nursing home scenario for our conflict, the roles in our conflict and their impact, and the resolution methods and why we chose them. We will also briefly discuss our group stage process and how we were able to reach community. For our discussion group, I'll interview the group members about the role play scenario, the methods of conflict resolution, and overall group process. First, Keisha, how did the group come up with this particular conflict?
We decided to use a nursing home example because none of us are currently working with that population. And we thought it would be better having something more neutral. Since I have some experience with working in a nursing home, I was able to guide us through all types of conflicts that arise in that type of setting.
Interesting. What about the roles within the conflict and the significance of each? Asia?
Well, Simone and I played the daughters of Miss Jenkins, who were going through our own guilt about placing our mother in a nursing home. And we had issues with the lack of attention that she was receiving by the staff in that nursing home. Jack played the nurse's aide inside of the nursing home. She was clearly frustrated by the lack of staff in the home and also by the frustration. Keisha played the social worker that helped everyone get an understanding of each other's thoughts and feelings. She facilitated the conflict resolution.
Okay. What about the resolutions they used, being seen, heard, and known, and common ground? Why were they chosen? Jasmine?
We chose to use being seen, heard, and known because we determined it was a good strategy for bringing people together who have the same common goal. In our case, it was Ms. Jenkins' care. but we didn't have the knowledge of each other's backgrounds, experience, and contributions. It was also crucial in initially diffusing the situation by making everyone listen to one another without interruption. Adding the background of the people involved also presented the perspective of each person and brought to light how each person got to that conflict stage.
We used common ground as our second conflict resolution method because it not only helped us to be seen, heard, and known, it helped us to clearly understand each other and how we felt about the situation. The social worker facilitated the common ground exercise and explained what we had to do in order to let us be seen, heard, and known individually. Each person had an opportunity to say how we felt without interruption, and we paraphrased what each person said. This helped us to have a better understanding of the situation, and also we were more comfortable and calm in explaining how we felt.
Great, thanks. Finally, we want to discuss the stages of our group work and our progressions together. Our group began in pseudo community for the first 2 weeks of meeting as we got to know each other and understand the assignment. We were both open to each other, but definitely had some anxiety about how to move forward. After that, we briefly touched on chaos in the sense that our anxieties had increased about our direction for the project. We did begin sharing on Google Docs and used an outline, which helped us to communicate throughout the week and move on to norming. Then we began to develop trust through that process as we were all providing input into the document. Our roles became more defined as we switched to process instead of task, and there was sharing of leadership roles as we problem solved together. Finally, within our last 2 meetings, I believe we reached community. We know that we accomplished this because we shared the purpose of completing the project, and we trusted each other to do our individual contributions towards the whole. Here are some of our resources. And finally, thanks for watching.